Hello everyone, I am Adriana Lopes and this is Connected, the podcast of Nova Economics Club. Today's guest is Adalberto Campos Fernandes, a former Minister of Health and professor at Nova National School of Public Health. He took part in Economia Viva, our cycle of debates, where he discussed with Miguel Guimarães, Ricardo Batista Leite and Pedro Pita Barros the topic European Health Union. If you want to listen to the full debate, just check the YouTube page of Economia Viva. Also, don't forget to follow Nova Economics Club on Instagram, Facebook, LinkedIn, and to subscribe our YouTube channel. On this episode, we will continue the discussion of this topic with Adalberto Campos Fernandes. In the recovery after the pandemic, it seems to be fundamental to support the creation of a European Health Union, strengthening the capacity to respond to public health crises in efforts to produce and distribute safe vaccines accessible across Europe and the rest of the world. In order to face this, Europe needs to promote a reinforced cooperation between member states in the area of health by supporting the actions needed to increase the capacity of health services to respond to public health threats. The Portuguese presidency of the Council of the EU 2021 reinforced the need to strengthen cooperation between member states in the field of health. So in the debate regarding European Health Union, at which point do you think Europe is, or which do you consider to be the next steps?
Hello, good afternoon. It's a pleasure to be with you, and congrats to the Nova Economics Club for this initiative. And thank you very much for your question. So, Europe is experiencing a very important moment in terms of the future, because the pandemic crisis revealed that we had some difficulties in responding to the present crisis. And we saw that particularly at the very beginning, in the moment when Italy started with the very serious events related to the COVID-19, and the lack of rapid response from the European Union was clearly noted from everybody. And besides that, also we feel that Europe was not in conditions to respond to the strategic needs, mainly with the medical supply, medical equipment, and even the production of medicines. So at this moment, we have some discussions in the European Commission and the European Parliament considering the need of develop a new framework to involve more responsibility, not only to respond to the global threats, mainly with the public health threats and pandemics and epidemics, but also with all the threats concerning the safety of people and the questions with the health providing and articulation of healthcare in Europe. So I believe that probably the creation of the new entity of rapid response foreseen to the end of this year will be the first step in Europe to create a new environment and a new framework of political approach to the health response in communitary terms.
The pandemic has shown the fragility of the healthcare system in different European countries. There was a lack of cohesion all around the world, but also within the European Union. When the pandemic arrived in Italy, EU countries were surprised by its magnitude, but it seemed to lack a centralized way to tackle it. When it spread all over Europe, the health disaster was under the eyes of everyone. The pandemic has made even clearer the need for a European health framework in responding to global crises and emergencies. All the countries have been affected, and this shows even more the need to develop a cohesive and strong union to face new future emergencies. As you mentioned, the pandemic has shown some limitations for a European Health Union, but do you think that the pandemic could have been avoided, or at least do you think that the health consequences could have been less fatal with a more integrated European health framework?
Unfortunately, I believe we are living in a global world with globalization, and it's almost impossible to avoid the circulation of biological agents all over the world because we have the flights, we have the communication between countries, and we live in Europe in the free circulation space. So probably you are right, we could have the opportunity to mitigate all the risks because we start late to articulate, to coordinate and to cooperate. You saw that the first aid that some countries gave to another countries started 3-4 months after the beginning of the crisis. But mostly, the most important problem for me is we are not prepared in terms of preparedness and vigilance and monitoring of these global risks. And everybody talked several years ago about the pandemics, the risk of a pandemic in the world, and the risk of the biological threats all over the world. So yes, we could have done better if you were more, if you had more articulation, more cooperation, less walls and more bridges between countries. If you had a conscience of the importance of having a strategic approach to the public health threats, but at the end of the day, we live in a global world, and you know that a virus that will start in Asia rapidly arrives to Europe and to the United States, and we saw that with SARS-CoV-2 and COVID-19. So we could have more performant and more competent, but probably we could not avoid entirely the risk.
In the European Union, there is still heterogeneity regarding the investment in health. In fact, in 2018, Germany and Sweden have spent around 11% of GDP on health expenditures, whereas Romania and Latvia have spent around 6% of GDP. This difference becomes more noticeable when considering that in 2018, Sweden spent around 5,000 euros per inhabitant, while Romania only spent 500 euros. In terms of quality, the EuroHealth Consumer Index is a study that, based on many variables, compares the performance of European healthcare systems. In 2018, Switzerland and the Netherlands were ranked first, while Romania and Albania were ranked last.
And a more thought-provoking question, do you think that it will be possible to harmonize all national healthcare systems into a single European health union, given all the differences across national health systems, even in terms of funding? Or do you think that the European Health Union will be more focused on common policies to foster health promotion or to tackle specific public health threats, but will not be focused on whether or not the treatments, the services will be similarly provided across EU members?
This is, I should say, a old dream from the European people and even from some European politics. But the public policy is outside the treaties and is not a competency of the European Commission, it's a national competency. So it will be necessary to make a revision or make a change in the European treaties, because the only aspect that is signed and foreseen in the treaties is the response to emergency and the safety of food and also the public health issues. So the providing of care, the provision of care, the health care assistance remains as a national competency. Probably with this crisis, we can move forward a little bit and understanding that in a political space like the European Union, where the first value is the freedom of circulation, we can be more ambitious in order to have more common responses. I think probably not in the next few years we will have an European health system integrated, but we can integrate in rare diseases, in some approaches that related to the travel of people, either in tourism, either in business, and some bilateral cooperation between countries that are closed, like Portugal and Spain, like countries of the Benelux and others. I believe that COVID-19 really opened the door and opened the mind of the traditional approach of health policies in Europe. It will be not sufficient to be aware of the public health risks to the emergent diseases. It will be necessary to have more integration, and probably if you have some evolutions in terms of integration of the European spirit, with more principles of common policies, probably in the next 5-10 years we can dream with a most integrated Europe in terms of social affairs and social protection and health protection. But by the moment the news and the most important event that we have that can, in my point of view, can influence this way is the crisis, the pandemic crisis, and the shock and the confrontation of the European making decisions and public opinion about the need of having more integration in health field. So I am moderately optimistic concerning this challenge.
Bureaucracy in the European Union has managed to develop a level of activism and an ability to shape policies in member states that appears improbable given its composition and constitutional limitations. Indeed, bureaucracy has facilitated reaching consensus in a diverse and complex environment as the European Union, leading the way of deepening the integration process since 1952. Nevertheless, the excessive bureaucracy associated with centralization has arisen questions regarding the political leadership in EU that may be weakening the sovereignty of EU member states. Yet, EU countries may still use their sovereignty to slow down the integration process, as in the European Health Union.
And given your experience as a former health minister, did bureaucracy ever play the role as being, let's say, a barrier to more cooperation among EU health ministers? Or do you think that the EU countries are still reluctant in possibly joining European Health Union, not due to the bureaucracy and the expected slowness in responding to urgent matters, but rather in terms of possibly losing sovereignty? How do you see this possible reconciliation between sovereignty and European Health Union in the future?
Yes, I agree with your question, and undoubtedly bureaucracy is a major problem in Europe, and in emergent situations sometimes is an obstacle to decision and to action. You know, the European Union is a complex aggregate of 27 different realities. And it is not like the United States of America or other countries in the world where the political nature allows more centralized decisions. In the European Union, practically every detail and everything must be negotiated, must be discussed, and that costs time. And you mentioned that about bureaucracy. Bureaucracy in Europe is not an event, it's not a hazard. I believe it is a need to create some checks and balances between the different political weight of countries, to avoid some minority decisions, to avoid the constitution of blocks inside the European Union. And you know, some decisions must oblige to an unanimous approach, and that is the reason why European citizens sometimes have the idea that the European Union is a very complex and difficult system of countries, of countries' alliance. But really, I think that your question raised a central question in political terms. Does the bureaucracy happen by hazard, or is the bureaucracy a tool of self-defense to the European decisors, to the European countries, considering that we have countries with a huge number of inhabitants and an important weight in economic terms. You can compare, for instance, Germany with Malta, and you see that this difference introduced the need of having what I called before the checks and balances. And when you have, you need to decide rapidly, sometimes bureaucracy comes and creates some difficulties in this decision. So it is not easy to make the governance of 27 different realities, 27 different wills and views from the idea of Europe. And when you arrive to the social fields and to the health fields, the situation is more difficult because it's easier to discuss financial and economic issues in the Council or in the European Commission or in the European Parliament, and it is less easy to discuss social protection and health protection because the difference of interest between countries is quite important. So we must continue to fight against this part of bureaucracy that does not help people and is not useful for people, but we must be realistic. In a complex and organization like the European Union, political organization, it will be not easy to suppress or to mitigate the effects of this bureaucracy.
So we are reaching the end of the episode. So I would like to thank you, Professor, for joining us today.
It was a pleasure, and I wish you the very best. And I hope that in the near future we have overpassed these difficulties, and you can, with your contribution, to help to raise and to build a new Europe, more a friendly Europe to citizens and to people. And thank you very much. It was really a pleasure to be here with you.
Thank you, Professor, and also thank you to all of you who are listening. We hope you liked it and see you in the next episode. Stay connected.